Guys, so today I'm going to talk about a book that I read. It's a memoir by Dr. Rana Awdish, an American critical care physician. The book is called In Shock. It details her experiences being a patient within the American healthcare system after a medical emergency and her opinions and thoughts about how it feels to be an American healthcare patient. I'm also going to talk about how it relates to India's healthcare. So, in to summarize, the book details Dr. Oddish's ordeal through a medical crisis. She actually had a benign tumor that ruptured while she was 7 months pregnant, which caused massive internal bleeding, multi-organ failure, just a very frightening ordeal. In the end, she does survive, but the memoirs just kind of detail her experiences within the American healthcare system as a patient, and she finds that there were quite a few issues that she experienced. The biggest is the fact that she felt that there was a lack of empathy in the care of the physician. She felt that doctors treated her as a case, not an individual to be acknowledged and helped. She was just a problem to be solved. There was also it also felt like there was often poor communication. Patients were told what was going on in very concise and like easily understandable language. This is, of course, going to be really hard for an individual who is not well versed in healthcare. But fortunately, Dr. Oddish is a physician. And it also just feels like, this just leads to a lack of, you know, this leads to a lack of attachment and emotional separation the from the perspective of the patient, which is fair, but in the end, physicians are there to help people. In the context of the Indian healthcare system, a lot of the themes that Dr. Oddish talks about kind of echo here within the Indian healthcare system. For example, um, many Indians are forced to pay out of pocket for their healthcare. A lot of times they just elect not to seek out healthcare. This often leads to confusion, fear, and whenever they do seek out healthcare, as we learned through this module, the government pays very little for the overall healthcare system. So oftentimes there's no time or training for any empathy or bedside manners for physicians. And a lot of times these hospitals are operating on a for-profit basis. So it can feel like they're just trying to churn out patients. Again, this leads to dehumanization of patients. Patients are not people to be helped, they are simply cases for them to make money off of. And again, uh, Oddish touched on issues of communication from physician to patient. This is going to be a big issue for Indian healthcare, as many Indian patients lack medical literacy. So it may often feel like, physicians could very poorly explain what is going to happen to them, just kind of making patients feel uh, less dignified, feel powerless, feel very confused about what's going on. So I think this book, while it may not be as great of an insight into the Indian healthcare system, it does capture universal truths about what it means to be a patient that is thrust into a system that, in the end, does not really care about them.